I know there's a lot of stories about you personally, and also you have done a qualitative study looking into women, specifically African American women who had gestational diabetes during pregnancy to understand their risk, whether they even understand their risk to type 2 diabetes. But before I dive into this, I want you to tell your story. And in telling your story, I want you to incorporate the problem, the background, and the purpose and significance of your study.
Thank you so much. Again, I thank you for this opportunity and allowing me to share my story as well as my research. So I invite you to travel back with me to about a decade ago, where the year was 2013. I experienced my very first pregnancy that ultimately resulted in an unexplained stillbirth after 20 weeks gestation. Soon followed the postpartum depression, the post-traumatic stress, the anxiety, the suicidal ideation, not having an explanation of what happened that soon created a container of fear, anger, and uncertainty that then fueled my doubts in wondering if I'd ever be a mother or a functioning student or person. With little follow-up care and no diabetes diagnosis documented, I continued my journey with life and as a doctoral student. The following year, I became with child again, and I was diagnosed immediately and treated as an insulin-dependent type 1 diabetic slash gestational diabetic at 6 weeks gestation, with at that time, I had a fasting blood sugar of 450. At 9 months, 37 weeks, I delivered a small for gestational age, 4-pound, 10-ounce baby boy. Born under significant stress into a mother with diabetes, he was hypoglycemic with a dangerously low blood sugar and intensive care for his first week of life. After 6 years of me experiencing medication mismanagement, hospitalizations, being misdiagnosed, and perfecting the art of self-advocacy, in December of 2020, I was finally diagnosed with type 2 diabetes. Still dissatisfied and challenged to change the trajectory of my life, in 2022, I moved across the country, stopped taking my medication, and created my own path to wellness. I am now diagnosed as a pre-diabetic with a standing A1C of 6.4. I now manage my life now with diet, exercise, and a lifestyle change. Through my story and research study, I vow to continue to elevate the voices of African American women who may have or will experience what I did. I am here for a cause, and I know this area of research because I have lived it. Marginalized women, particularly African American women's experiences, are valid and deserve to be treated with optimal respect and care. Believe Black women. Pregnancy in African American women has become a preventable public health crisis.